Hi everyone, this is Sean with the MassSupport Network, here with your COVID-19 update for Tuesday, December 15th, 2020. So it was a big weekend, but before we can get to the developments, let's look at how the cases are doing worldwide and across the country, where we saw 5.2 million new cases in the last week worldwide, the first time we ever crossed 5 million cases in a week. Here in the United States, we saw another new record of 1.5 million new cases. And here in Massachusetts, we saw 35,000. Those are all significant increases from the week before. Here, now we're looking at deaths. These have not spiked as much, but are still increasing everywhere. Worldwide, seeing 77,000 deaths from COVID-19, which is more or less the same as it was last week. The United States saw 17,000 deaths, which is about 2,000 more than the week before. Here in Massachusetts, we saw 353 deaths from COVID-19, about 66 more than the week before. Looking at these trends graphically, we are reaching new highs constantly in terms at least of our 7-day averages. There is usually a single day high on Friday or Saturday, and we have recently passed those on cases and deaths, though hospitalizations each day is a new high, as we've reached over 110,000 people in hospitals across the country. Now, in terms of the actual case counts, looking at the census regions by million people, as you can see here, the west of the United States has actually passed what was until just now the epicenter of the pandemic, the Midwest, which doesn't appear to be trending downwards now somewhat consistently. But note also that the Northeast and the South are also moving up pretty quickly on the total number of cases, or at least by population. We hear the Northeast may soon pass the Midwest in terms of cases by population in this current surge. In terms of hospitalizations, the Northeast, South, and West are all still trending upward, more or less the same rate they were before. The Midwest does appear to be steadily dropping off, which hopefully suggests that the surge there has burned itself out, but there's still a lot of the rest of the country that can still be hit by this. When we look at the hospitalizations by million people, there are still just swaths across the country here. Very few places are low, just Vermont and Hawaii, which are, as we all know, two of the most remote parts of the country. Nevada and Arizona are seeing the most hospitalizations by population, with Arizona even passing its summer surge, which is very troubling. The peak in New York in April was 968 people per million people in hospitals. So we're not quite there yet, but I mean, Nevada's at 2/3 of that point right now, and we still are likely have a long way to go there. And in terms of deaths, everywhere does seem to be trending up. Perhaps Midwest might have peaked there, but the hospitalizations trending down, so they probably are not out of the woods just yet. There is usually that lag where hospitalizations will be trending down, but deaths will still be holding steady for a little while before those start to go down as well. But with that, let's move on to developments, because we have big news, of course. Everyone's talking about. Here's my best stab at a 1940s New York Times headline. We have a vaccine. The Pfizer vaccine has been approved, has been deployed, and inoculations have begun. The first shipments have started arriving in Massachusetts as well, but across the country, vaccines are going to hospitals and have started to be injected into people, internally healthcare workers. So this is the big news of the day, that we are now starting our vaccine campaign, and the next several months are going to be about vaccinations. We may even start tracking the number of vaccines deployed along with the other numbers like cases, hospitalizations, and deaths, which would be exciting to have one kind of positive thing to track there as well. Bear in mind, of course, it does take a while before a vaccine becomes effective. Now, the first dose is not really going to show effectiveness for a couple of days. There is some talk that with the Pfizer and Moderna vaccines, which are 2-dose projects each, that the first dose will actually give pretty good protection, about a 50% efficacy of protection. But then after the second dose, which is going to be given 4 weeks later for the Pfizer vaccine, which is the only one approved right now, Pfizer is 3 weeks, Moderna is 4 weeks. That's when the full efficacy will come into play a week or two after the second dose is received. It's also worth remembering that all the vaccine numbers we're seeing are actually twice the number of actual vaccinations we will get. So here in Massachusetts, we are expecting 300,000 doses expected by the end of the month. 180,000 from Pfizer, 120,000 from Moderna. However, this means 150,000 actual vaccinations potentially, which is roughly the same number, slightly less than the number of active nursing licenses in the state of Massachusetts. So it's a good start, but it's nowhere near what we need to really curb the spread. It might be enough to keep our hospital system from getting overwhelmed, which would be great. But of course, we're still looking at probably about logistically a solid 2 months before that really starts to kick in for us. Also, of course, with inoculating hospital staff, they have to go in shifts. There generally is kind of a rough day or two after the second inoculation generally. So they want to make sure they're not laying people out from the vaccine to mess up hospital shifts if they give everyone them at once. Other vaccine news too, the Moderna vaccine could be authorized by the FDA as early as the end of the week, which is very exciting because then within 1 week we have not one but 2 vaccines, and just really get started to the massive vaccination campaign we need to get the virus under control. And that's what the next couple months of our lives will be about, is getting these vaccines out into people. So that's really all there is to talk about today. Looking at our vaccine progress chart, there we have it. Finally, vaccines in approval. Now there's actually 2 out there worldwide. The Pfizer vaccine has received full approval in Canada and parts of the Middle East. It's still under early use authorization here in the United States. And the other one that is approved is the Sinopharm vaccine from China, which is approved in parts of the Middle East as well. Also a new category added there. One vaccine project was abandoned, a project out of Australia, where the vaccine was causing false positives for HIV tests. And that project was scrubbed. We'll probably see that category advancing a bit too in the coming months as more of these candidates which are in early use or phase 3 become approved. Some vaccine projects which are still early on and not showing promising results may be scrapped altogether. And once we have a couple vaccines approved, that's not so much of a problem considering how much we have pending here. And you can find the sources for our numbers at the COVID Tracking Project, New York Times, and mass.gov. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.